Hello, my name is Kelly Tebow, and I'm with the New Jersey Center for Tourette Syndrome and Associated Disorders. I will be your organizer for this evening and would like to welcome you to our webinar on chronic illness, psychological and educational impact. Thank you all for joining us. Before I have my colleague introduce the speaker for tonight, I'm going to cover some housekeeping items with you. All participants are muted. If you have a question, please type in the bottom of your question box and click send. You may send as many questions during the webinar as you'd like, and we will have Dr. Zarabi answer the questions at the end of his presentation. We will get to as many queries as time allows. In addition, tonight's presenter is available to take your questions on the Wednesday webinar discussion board. This discussion board will be monitored for the next 7 days. Feel free to look and post questions as often as you like. Answers will be archived for future reference. If you missed part of the presentation or would like to hear it again, an archived version will be posted to the website shortly. We value your input, and in order to expand the webinar experience in the future, we need everyone to fill the survey out as you exit the webinar. The New Jersey Center for Tourette Syndrome and Associated Disorders, its directors and employees, assume no responsibility for the accuracy, completeness, objectivity, or usefulness of information presented on our site. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now I'm going to turn over the introductions of our speaker to Martha Butterfield, the Program Coordinator of NJCTS. Marty?
Kelly, thank you, and good evening everyone and welcome. Before I introduce tonight's presenter, I would like to take just a moment to tell you some exciting news. Well, it's exciting for us in any event, that beginning today our website is now mobile friendly and can be easily viewed on your smartphone, Droid, or iPhone. Our web address is njcts.org, and you can access our calendar of events, support group, webinar schedules, along with other calendared items all on your phone. We're very excited about this and hope that you will continue to log on and stay connected and be informed. Now, without further comment, I'd like to introduce tonight's presenter, who will be addressing chronic illness and its psychological and educational effects. Dr. Michael Zarabi received his doctorate from Rutgers University Graduate School of Applied and Professional Psychology. His clinical training focused on school psychology and cognitive behavioral therapy, and his graduate work included research in the area of chronic illness and disease. He is in private practice conducting individual and group therapy with children, adolescents, and adults with various psychological and behavioral conditions, including mood and anxiety disorders, OCD, ADHD, autism spectrum disorders, and learning disabilities. He also specializes in the treatment of chronic illness and its impact on students both psychologically and educationally. Dr. Zarabi is a certified school psychologist providing parent consultation, academically oriented therapy, and diagnostic psychoeducational evaluation. He has presented at psychological and medical conferences in addition to support groups and community forums. Dr. Zarabi, welcome to our Wednesday webinar series, and I will now turn the presentation over to you.
Thank you very much, Kelly and Martha. It's a pleasure to be here this evening, and I want to thank everybody listening, taking your time out of your busy schedules to listen this evening. I'm very passionate about this topic, and I just wanted to take maybe a minute or two to kind of give you a quick background as to why I'm presenting this topic tonight. I grew up with a chronic illness, diagnosed at age 12. My high school years were very difficult. I didn't have the services that I needed. Psychologically, it was very, very impactful. And when I entered the field of psychology and did my graduate work, I really felt this was just a need, a very important area that I think affects many children, adolescents, and adults as well. But really, in terms of the school functioning, I didn't feel there was enough out there, and I really wanted to, fill that gap. And so I focused my studies, my training in this area, and really want to get information out there to everyone, including personnel in the school and so forth, so they're aware of this important topic. So I wanted to get right into the discussion. First area, basically, first slide talks about different things I'll be discussing this evening. You can see just the different topics I have up there. I will try to cover as much as possible. If you do have questions, obviously, please feel free to write them down. But I think this presentation tonight does cover quite a bit. Just some general information you have in front of you about chronic illness. It does affect, believe it or not, it does affect quite a number of children in the United States. And really, when I first kind of came across that percentage years ago in my studies, it was alarming, and it's increased a little bit since then. But pretty much, it's chronic illness affects everyone, families, and many people involved. So I think probably a lot of you maybe understand chronic illness, but just to get a general idea of what a chronic illness is, it talks about basically a condition that interferes with your daily functioning, lasting for a long time, and it really does compromise different ways of functioning, mental and physical. So it's not something that's here and there. It's really more consistent, and it's continuous. And it does have a major impact on your daily routine. So this topic of emotional aspects, this area, this is something that is key when we're looking at dealing with a chronic illness. There's several areas that we deal with a disease. A lot of kids go through this. You may not be aware of it. It may not even be overt, but it does happen, and it does come out in various ways. Like you see, from rejection to isolation to puberty, we see various things, various ways that chronic illness affects a child. A lot of absences from school. That's a major piece, because we don't realize that, you can be ill, but you're also, really having other things involved with your illness. And so you may have medical procedures, and you may have things that are keeping you from learning. And then coupled with that, you have anxiety, and you have headaches and other real symptoms that make it hard for you to be in school or to participate in different aspects. And, for families, I think that the emotional piece is important. How do I handle my child in the home? What can I do? And we'll talk a little more about that as we move into parent involvement. But it's a very tough thing for families. I deal a lot with kids who come in. I have students with cystic fibrosis and asthma, diabetes, IBD, and I'll have a case where most recently where a child was recently diagnosed with actually Crohn's disease, and the family had to learn really about the condition, and the child was going through so many different emotional ups and downs, and the parents, it was all new to them. They had no idea how to handle it, and we kind of had to start from scratch and say, well, you know what, let's right now outline what is actually happening. There's depression, there's anxiety, there's physical complaints. Let's take one piece at a time, and instead of focusing on the negative, let's focus on positive, which I'll get into in my discussion. So it's a lot for a family to undertake, and so I just wanted to kind of mention that as a key point. The last piece there, as you see, psychiatric diagnoses, depression and anxiety, which I want to get to on my next slide. Just so everybody has an idea, the difference with depression. Depression in children, adolescents, and adults, there is a marked difference. And it's important to kind of outline these different pieces. Up on your screen, you see various symptoms from irritability to worthlessness and so forth. These are red flags. It doesn't mean your child has to have every bullet there and every symptom, But if you see a few of these things, you may want to consider contacting a professional or at least a counselor in your child's school to kind of get an idea. They may even tell you we're seeing these things. So it's important to kind of pay attention to some of the symptoms in childhood depression that you're looking at. Adolescence, some of it's similar, but we also have to think about the adolescent now in terms of hormones and changing behavior. So we see more belligerence with adolescents, and the self-esteem is more prevalent. We see, it's much more negative. Of course, we'll see, lethargy and so forth, and then of course, in a little more rare instances, we see suicidal ideation or suicidal thoughts. Again, the adolescent does not have to have all these areas, but if you're seeing some of this, again, it's really important to just be aware and contact a professional inside or outside the school when you're seeing some of these symptoms. And if you notice on the bottom, which I'll mention later, I have a little footnote there of a great author who's written several books on depression, OCD, negative thinking, and she really has a wonderful techniques and behavioral interventions for children and adolescents who are going through these emotions. So you may want to look her up and see if you can pick up some of her books. They're really cheap and they're great tools. A major depression diagnosis, so everybody has an idea. When we're talking about a real depression diagnosis, we're looking at specific symptoms that have to occur in a certain type of framework. Every day, most of the day, depressed mood, low interest in activities. It interferes with your daily activities, and it has to be a marked change. It can't just be a few things here and there, but it's some people say, well, my 15-year-old is always down or doesn't want to talk to me. And you know what? A lot of teenagers are, but when we see a marked difference from their everyday behavior that we don't normally see, that's what we're talking about when we look for depressive symptoms. And I tell all my patients, they'll come in and I'll say, listen, let's rule out some medical issues here. Hypothyroidism, I always tell my patients, have your child or adolescent tested for a thyroid condition. Go see your MD, your pediatrician. Have them rule that out because that can really mask depression in many people. So we look in addition to adults. So I always tell patients to really have that checked first if you're seeing a lot of changes in emotions in a short period of time. So I wanted to get into some different ways of coping. Children and adolescents really cope differently. They're not all the same, and I even mentioned infants here. You can see there's different ways of internalizing and dependency. I wanted to just kind of glob onto adolescents. Adolescents really require family and peer support. They really look to their friends for a lot of support. They want their family to be there, but I find with my patients, I had one patient in particular who really, who was dealing with some diabetes, and it was a recent diagnosis, and he did not want to discuss anything with his family. He actually had a major, peer support group, which he always talked about, and you know what? That gave him a lot of help. We worked on getting the family involved, and eventually, he was talking to his family, and we had the family come into sessions. But the peer support group is important. Even if your adolescent doesn't have many friends, that's okay. As long as they can reach out to someone. Overall, educating, your child or adolescent about some medical stressors really can facilitate their coping, and it helps them get through the tough situation. So just remember, the more you know, the more they know. Some strategies I have listed, education and modeling. I like modeling just because I think modeling is so impactful. We tend to forget some of the things that we're demonstrating to our child, unbeknownst. A smile or a smirk or a movement of our eyes really can have an impact. So exposing your child to different sights and sounds of the techniques, the procedures they're going to go through, having them speak to somebody who has been in a similar situation. It doesn't have to be that illness. It could be, another illness or another person who went through hospitalization. And we really find that the modeling and the expressive feelings can have fewer symptoms. We see a lot in IBD patients, and I've had patients who have done so much better once they start opening up, whether it was in a peer support group or in my sessions or even with just their family members. It could be huge. So, educating and modeling is very important. Now, in this piece of the coping strategies, the relaxation and the cognitive strategies, yes, this is going to be an area that you'll tend to find a little more in professional settings. I have it up there because it's still something you could absolutely do at home with your child, with your adolescent. I definitely do these in my sessions with my patients. But, deep muscle relaxation, breathing, imagery, guided imagery, just in case you're not aware, is basically a technique of closing your eyes and having someone walk you through a very calm and serene image in your mind. It could be a beach. It could be a place in your home. It could be outside in your yard. It could be somewhere, maybe even at work, that's a quiet place for you, if that's even possible. But guided imagery is walking someone through a serene image in their mind. And then cognitive strategies, want to just clear up one area there, reframing of physiological sensations, just in case we're not aware of that. It's let's not focus on negative, let's focus on positive. And I'll speak about that in another slide, and I'll give you some examples of that. We tend to really focus on, all the negative pieces of a chronic illness instead of recognizing that there can be some positive things that we're not maybe aware of at the moment. And mindfulness is just being aware of your body and how that works with your symptoms. Before I mention parent involvement, I want to reach out to my parents tonight and let them know that there is a big influence here with their children, helping them cope. There's a lot you can do. And I mentioned some things like coaching, education, modeling, being there for your child, doing as much research as you can on the chronic illness, knowing as much as you can. The more you know, the more helpful you're going to be. Don't be bashful to ask questions to your pediatrician. If you need to, a lot of times pediatricians or specialists want to, meet you for 5-10 minutes and walk out. That's your doctor. Ask them to spend some more time. Ask questions. Don't be bashful. It's important that you know everything you can. Coach your children. Talk to them about it. If you have little small children, and obviously, you have to kind of be on their level, you can give them some basic information. You may not want to say too much to your 4 or 5-year-old because it can make them upset. But the basic information, if they don't understand why their belly is hurting or their head is hurting, some things that are just basic for them in terms of, that yes, it does hurt, and I know it hurts at night, and it's, it's tough, and we all have things, and mommy and daddy have things that we deal with. My leg can hurt, and kind of basic layman's type of phrases to use with your children. So the parent involvement is really important, and that home environment, less stress, the better off you'll be. All homes have stress. It's impossible to get rid of all stress. But if you can implement some structure in the home, have things kind of set up where it's not going to lend itself towards, just an anxious type of environment where everybody's nervous around the child who has the illness and what they're doing every minute. That's going to make your child nervous, and they're not. It's going to be hard for them to cope. Validation of feelings. Again, I love this because these are some examples, but when you can tell your child lesson that you kind of understand what they're going through, it sounds like it's not fair, and this must really be hard for you. So letting them know you understand, you get it, you know. It's better than saying, you know, oh, it really does hurt? Oh, okay. I know you don't like it. I know. It'll go away. It'll go away. It'll get better. That doesn't really necessarily help them in the long run. Letting them know you understand it is a little more impactful for them. So I like to do this in validation. Changing the responsibility is really just kind of getting your child to take responsibility for their illness, and you want to start it, not too young, but you want to give them, that responsibility. Case in point, I have a patient who has cystic fibrosis, and with cystic fibrosis, a lot of patients have to use what they call an oscillator vest, and it breaks up the mucus in their lungs, and this boy from an early age just would not do it, and when he doesn't do it, he can get very ill, and he had his parents just always reminding him and kind of like putting it on him, and I really had them tell him to just do that by himself. Have him start to make reminders for himself on the calendar to put his vest on, so he can at least take responsibility for that. And that led to some more things. And by the time he was late adolescent, he was really doing almost everything himself, and that was great. Same thing with like an insulin shot I have down there, medication charts. Had them do it with you. If you take medicine, have them do that with you, and map out the days. So they at least, because if you start it later on, it's going to be much harder for them to take that responsibility, and there'll be more resistance. So I say, start it when they're younger, and give them a small task, and you can kind of increase it gradually. Some more involvement. I mentioned before the physiological state, the physiological sensations, reframing them from "I'm always sick, I never get better." Try not to focus on that. You can even ignore it. But if you don't want to ignore, you can say things like, "I know it's hard to be sick," or "I know it seems like you're ill a lot." But remind them of when they felt well. Yesterday you were really running around and you seemed like you were having a lot of fun with John outside. You really have a lot of energy today. So I just want to kind of read you some of those things, even though you have it in front of you, just because it gives you an idea that let's not focus on those negative pieces. Let's remember that there are some times when we can feel well. It may not be like that all the time, but there are moments, and we need to kind of remember those moments and have your child remember those. So I mentioned before about adolescents and peer relationships. Really, peer relationships just, I think, have a major impact. Even for those students who don't have a chronic illness, just having someone to be there helps a lot. When we have a chronic illness, it can disrupt so many areas. It can disrupt social activities. It can change independency and autonomy. If a child is just clinging to their parents for many years and their parents are always there for them, it stifles them from kind of leaving that nest and making some more friends and reaching out to it, because they're afraid, what if I'm sick? What if I go to my friend's house and I get ill? My parents won't be there for me. So, it can affect relationships that way. And we see a lot of psychological and social problems that do come out of chronic illness. So it does have major effect on peer relationships, and it's important to be aware of that and to kind of recognize, is my child really with the right people, and are kids moving away from my child, and is it impacting them, socially and peer-wise? I always try to say to make sure your kid, as parents, we always try to make sure our kids are hanging out with the right kind of people and spending time with the right type of person. It's important with chronic illness because you don't want your child to be made fun of. You don't want them to be with the wrong person who doesn't understand what they're going through. It's one thing for a child to ask questions, that's fine, to clarify, but to say things like, that's weird, or that's scary, I wish I didn't have that, that's not going to help your child. That's going to make them feel worse. So it's helpful to establish healthy relationships outside of the disease context as well. It doesn't have to be someone who has diabetes also. It could be someone who has a different condition, or even just no condition, just someone else, which can be great. And I have done some. Utilizing some group therapy is also very helpful as well. Want to talk a bit about medication, and I do want to just preference, I'm not a psychiatrist, I'm not a medical doctor, but I have a lot of experience clinically just working with patients who've been on medications. Almost all my patients are, whether it's anxiety, depression, a learning disability, ADHD, or a chronic illness. And myself, I've been on medication and still am since I was 12. So I know quite a bit, but again, any specific dosage information I would not be able to speak about. So tonight I'm just going to talk to you about basically what we're looking at. So want to make sure what your child is getting from your doctor. There's not much data on psychotropics. Psychotropics are things like depression medication and anxiety medication. Adolescents really don't want to take their meds. That's a tough age to work with. And I like to, I like to help parents, increase that medication adherence, contingency, if you can take your medicine 2 days in a row, we'll reward you with this on the third day. Some kids may need a quicker reinforcement, an earlier reinforcement. It doesn't have to be a big monetary gift. It can be a favorite meal. It could be a movie night. Use a calendar to help them cue for medication administration. Sometimes kids take medication and the medication makes them feel lousy, and it can have serious side effects, and the kids don't want to take it because they know they feel lousy. That's a tough one because they have to take it. I would work with your pediatrician, your specialist, on different types of meds that are out there. There are always new things popping up. So see what else is out there that has less side effects. Maybe speak to your pharmacist, because sometimes they can kind of make it taste fruity and this and that. But then again, the actual side effects can be difficult. It can cause nausea. That's a tough one. Sometimes I'll tell parents, if the child has to take 2 pills a day, don't take it all at once. Split it up. Take, if they can, if the doctor lets them. Take 1 in the morning, 1 at night. Break the dosage. Put it into juice. Put it into milk if it's having a real serious side effect. So it's something to think about because it's tough when you don't feel well and you don't know what to do because your child, really doesn't want to take their medication. We've seen a lot of behavioral effects in my practice. The miracle drug in my experience has been steroids, prednisone. Really helps a lot with so many different areas. We'll see antihistamines and analgesics help, but these, the steroids, they can have a major effect on emotions. I myself have been through periods of medication and have had my bouts of depressive symptoms and trouble sleeping. I've seen so many of my patients come in, can't sleep or having night sweats, and they're just very moody. And then when that medication stops, it disappears. So really want to be aware of that. And the physical effects, we mentioned puberty, but also there's weight gain and sleeping, acne, which really can have a stigma for the child. So it's important to pay attention, to know ahead of time, asking your doctor, what is this medication going to do to my child? What's going to happen? I need to know everything. So you can kind of prepare and do your best to make your child aware of what may occur. General awareness, I think, is huge, and we're going to move more into the school area at this point, but really general awareness to the right personnel in the schools, talking to everyone. Again, don't be bashful. Don't think, oh, I'm being a pain and they're not going to listen to me, because you know what, nowadays I will tell you that more people listen than not. And if they don't have the information, it's going to be harder for your child to be successful in school. So advocate for your child. Push a little bit. It's going to be helpful in the end. When I get into some school services, I'm going to go into things like an IEP and a 504, and I will explain what those things are. And I'll also be talking about, accommodations that we can do for the kids in the school for you professionals who are listening, teachers, counselors, anyone else, what can we do for our kids who have chronic illnesses? And, me being in the school as a school psychologist, I come across this quite a bit, and I'm really in contact with my school nurse so I can know more about the disease, the illness, and what I can do. So just I'm not going to go into all the details. You have it in front of you, but an IEP is basically an education. It's a federal legal document given to students who are in special education only. And it really outlines how they learn, and it's a helpful guide for the teachers to know, how can I teach this child so they can learn in their best way? And that's really what this IEP is, and I'll talk to you about the process. There's also, it's not on here, but there's also something called an IHP, an individual health plan, that really works more with the school nurse, and you can have that. That is not special education. That's just really just dealing with a medical condition only, and it does provide certain accommodations. The IEP, as I'll explain in a little bit, is more stringent and is a legal document, and there's a lot more involved there. Again, there's an eligibility process for an IEP. It starts with an Intervention and Referral Services Committee. That's like the first step, and that's where you go to kind of get some accommodations for your child if they're having some difficulties. So some schools used to call it a PAC committee, but now it's called, well, at least in New Jersey. I know maybe we have some people from other states listening in, but there's usually a committee that is run by a vice principal or a guidance counselor that is there to put in some basic modifications for a child that's having difficulty. Another method, another avenue you can try is something called a 504 plan. A 504 plan, now we're talking about an actual legal document like the IEP. And again, there's different pieces to the 504 plan. It's a document that was put in place not to discriminate against people with disabilities, and school districts utilize them quite often. But there's a catch, because, as I'll talk to you in a minute, there's no funding from the state. So some school districts will say, we don't want to do this, and they may give you a hard time. But it can be a very helpful document that I like to look at it as the step right before an IEP. An IEP, in my view, is last resort. But 504 can also be extremely helpful, and you may not have to jump through as many hoops. But we'll talk about that in a little bit. So for a 504 plan, it's basically teachers and parents involved. Make sure you're there for all the meetings. Just be part of that. They will want to evaluate your child, probably informally, and they really want to make sure, the school district I'm talking about, that the illness, whether it's, ADHD or OCD or, diabetes, that it's really impacting education, that it's impacting a major life activity, that they are not doing well in school, or there's some kind of interference because of this direct interference because of their condition. And you may need to provide documentation from psychologists, psychiatrists, pediatricians to really make them listen. But it's something that if you feel you need to do, go for it. It doesn't cost you any money, and your school district can be very open to doing this. And so it's something to really think about when you are in that kind of situation. Just so we have an idea of what of the differences between IEPs and 504 plans, like I said, IEP special ed, 504 is only through regular ed, so you're not going to have to deal with anything regarding special education. And the funding, as I mentioned, you can see one is state funding and one is money from the school district. Just so you are aware, if the school district gives you a problem with a 504 plan, don't just kind of say okay and walk away. Try to push that, because they may just not want to go through the rigmarole, and usually 9 out of 10 times there is no money issue, because the accommodations you're requesting, like extended time or a copy of notes or extra set of books, really does not cost anything at all. So I would push a little with that one. In an IEP, it's a very stringent classification system. And so once you receive an IEP, you're in the system, and you can come out of it. You can be removed from it. And if you are removed from it, remember that if you had an IEP and you no longer need one, but you still feel your child needs something, you are automatically eligible for a 504 plan. And I can't tell you differently. So that's because the IEP is like the catch-all. So just so you're aware. A 504 also, you need to kind of demonstrate a major significant impairment. But there is no category, there's no classification. Your student is not, in special ed. So some parents like that. An IEP requires a full evaluation by a child study team, but a 504 does not. If they want to do certain formal evals, I would question that a bit because it is not needed. It's really informal. Maybe an observation, talking to some people, interviews, teachers, and so forth. They're not required to have your consent, but it's obviously recommended. You want to say yes, do this, or not do this. Most school districts will only do it if you agree. They won't. Usually they don't. It's not of their own volition. In IEP, students are in special ed. We know that. And they receive accommodations. In 504 plans, they do receive accommodations and modifications, and they're not typically as extensive as an IEP, but they can be. So if someone tells you, oh, well, it won't be that many, it can be that many. But if you're looking for a child to receive a special education classroom, like inclusion, where there's a special ed and a regular ed teacher, and you want this through a 504 plan, you're going to be hard-pressed to get that. Technically, you can get it, but as long as it doesn't take away time from a student that's in special education. So, like I said, it's going to be hard for you to, receive that classroom, but it can be done. I want to talk about modifications for a bit now. I have up, as you see, general accommodations that you can have the INRS committee do, that you can put down in your 504 plan, you can put down in your IEP. But let's talk about teachers for a minute. What can they do in the schools? What should they be aware of? I recommend to teachers to, one, if your child comes in with a chronic illness, really try to, hopefully you won't know unless a school nurse tells you or a parent. Once you know, first thing first is, unless you really have a lot of information about the illness, spend a few moments to do some research. Look it up. Find out what the symptoms are, how it affects them, overtly, and look for those symptoms. But also ask the parents. For instance, Kevin has Crohn's disease. Well, what is that? What is that going to look like in my class? Ask the parents. Well, Kevin's going to use the bathroom quite often, and he may have stomach pains. And if he's looking at you and he seems like he's paying attention, but he shuts his eyes, that's a sign that he's in pain and he may need to be excused. You wouldn't know that unless the parent spoke to you. So ask those kind of questions. What should I look for in class? Is there anything I should be aware of in terms of physical manifestations, physical awareness? Should they sit next to the door so, it's less disruptive? One of the things also is that we see a lot with chronic illness, as I mentioned before, anxiety and feelings of being overwhelmed. Break down the activities for the children if you can. If you have assignments that are due, that require, let's say, 2 pages of a written assignment, maybe have them submit 1 page at a time. And for you parents out there, you can make that suggestion to a teacher. Say, my son, my daughter feels overwhelmed, they're feeling ill, and they're not sure if they can complete the work. Can they hand it in pieces? I think if a teacher is understandable, is understanding, and there's no, the child's not abusing their assignments, that's a very easy thing to do. It does decrease anxiety. It can be just very helpful for the student. And like I said before, just close contact with the school nurse. That just kind of talk to them a lot. And if there's a case manager in special education involved, speak to your case manager. Make them aware of things you know, and keep people up to date. Email your parent. Let them know that today Kevin, felt nauseous. It's important for them to know that because they can talk to their doctor about it. So just want to put that out there for teachers. And as you see on my list here, I've mentioned a few things. One of the things I think a lot of parents aren't always aware of is a home instruction piece. Home instruction is instruction at home that takes place typically after the school day. It can take place during the day, but a lot of home instructors work after school. It's not homeschooling. Homeschooling is removing your child from the school totally and teaching them on your own. This is home instruction that must be provided by the school district when your child is out for 10 consecutive days. And on that 11th day, they need to start providing it's a minimum of like 10 hours a week covering all your subjects. So for little children, it covers all their areas of math, science, and so forth in high school, and it may cover a language. But for chronically ill children, I had one patient who last year had a kidney disease and was awaiting a kidney transplant, and was very ill and actually required just a partial day. The mornings were very tough for him, and I know mornings can be so tough for so many children who have chronic illness, who have different conditions, and he actually would just wake up late, go to school at like about 10 o'clock, have a few courses, and then come home. And this worked out very well for him, and he was able to complete everything. So if no one is if you know your child's going to be out a certain amount of days, or it's just not making it, and you see that they're out 3 days here, 4 days here, and no one is talking to you about home instruction, you can bring that up and discuss that with them. Just for my IBD patients, maybe you're not allowed to listen tonight, but those of you who have stomach issues, and I'm just talking personally because it does. I have this condition. Make sure those bathrooms are not locked in the schools. They should be open at all times. So again, looking at different things, extended time, SATs are really important. That can be done through a 504 plan and an IEP. If you have neither of those documents, I would recommend you then looking into some private evaluations for your child or adolescent, so you can get some standardized test scores to show that there's a need. If you have an IEP or 504, it's very easy. It's pretty easy to get this extended time on the SATs, and you have to apply for it. But if you don't, like I said, you may want to look into some private testing to get that. Who do you contact? Yeah, I'm not sure. Who do I go to? All schools have a 504 coordinator. It could be an assistant counselor, a student assistance counselor. It could be a vice principal. It could be a guidance counselor. And just all you got to do is call and say, who coordinates the 504 plans? And that's it. It's a very basic question. And if the front office says no, call the guidance department. But somebody will know. It's there in your school district. Special education is also there. It's in every department. It's everywhere in the country. So, just ask. And just so you're aware, I know you can see in front of you, but just so you're aware, a child study team in New Jersey, it does consist of 3 people, and they are going to help you through that special education process. They're the ones that meet with you. Just want to talk for a bit about families out there who are at the end of the high school career and are looking either towards, higher education or a work environment. I have some things here just to kind of be aware of for college. What will the colleges offer? Visiting your college, contacting the admissions department. Just so you know, if your child has an IEP or a 504 plan, and you decide, because it is your right to do so, to inform the college that your child has this document, it cannot interfere with your admissions. That's against the law. They cannot discriminate. There's no against a disability. So don't worry that your child wouldn't be accepted to a good school because they had an IEP, if you want to divulge that information. I recommend you do, just because the college may say, oh, so this student had some difficulties. They are not required, colleges, to grant you the exact accommodations you had in high school, but they will work with you on giving your adolescent what they need to be successful. And you want to meet with them definitely before you start school. So just be aware of that. And even for vocational, those who are going to the workforce, talk to your boss. You know, they can't discriminate, of course, against you as well. So let them know, you know, if there's any limitations you have, if you need some assistance with certain things, and you know, be aware of your surroundings. Go for tours of the job site and see what's out there, and make sure what you're getting into. So, you know, this is, I think, something that's important for you to be aware of in terms of moving forward after high school. So, you know, just a summary of tonight's discussion. I think the one key piece that I want everybody to take away from is that I like to look at chronic illness as such. I'm healthy, but I have diabetes. The illness should not define your child. It should not be how you look at them. Oh, there's Johnny with asthma. No, it's, hey, Johnny, how you doing? And Johnny happens to have asthma, and he's dealing with it. But it's not how we define the person. And, you know, really don't, like I said, don't be bashful. Make as many people aware of your child's condition as possible in the schools, you know, even your pediatrician, and talking to them about the different things you're reading about of the illness, studies you've seen, conferences you've been to. Increasing awareness helps everyone, and sometimes parents will say, I don't want to be that parent who makes a stink and they're going to not like me. If you do it in a nice way and not in a pushy, angry way, people will listen. And if you talk calmly and you make sense and you work with everyone, it's going to work out for all who are involved. So I just want everybody to kind of really take that away from tonight's discussion. Lastly, just have some suggested reading for everyone, stuff regarding 504 plans and IEPs, chronic illness, relaxation. Basically, you know, I have a book out there about it's more specifically about inflammatory bowel disease, which is Crohn's disease and ulcerative colitis. You know, stress and so forth. So, you know, reading is wonderful. Paying attention to different resources is huge. Know as much as you can, and that's what I recommend to everyone. So that's it for this evening. Thank you very much for your attendance and taking your time out. And now, you know, I think we're open to any questions.
All right, thank you, and I'm going to launch right into the questions that have been posted. We have a teacher looking for suggestions from you on how to handle a first grade student whose father is the one that is terminal. I don't want to say terminally, but the father has cancer and he's not doing well. So are there any suggestions you can make to that teacher about how to handle that situation with the student?
Yeah, you know, that's upsetting actually to hear that, and it must be actually pretty hard for the teacher because you know, the child may be coming into your classroom and already is upset and not wanting to participate and so forth. What I would say is, one, if the child comes in and they're upset, they're talking about that, validate those feelings and say, you know, it seems like you're having a tough morning, and you know, You look upset this morning. So kind of letting them know that you're there, that you're aware that it's upsetting for them. Not just ignoring it. I don't believe in that for a child that age. Making them know that you're near them and that they can come to you. One of the things that, maybe you can do in first grade easier than you can do like in older, with an older student is maybe if there's some time to have them draw some pictures and talking about that. If there's, if you have some downtime in your classroom, or if you do circle time, or if, choices or centers, drawing pictures can be very cathartic, can be very expressive and opening, and have them kind of write down some things that are helpful for them. They may not be able to write long sentences and things like that, but just drawing a picture is helpful. Even letting the art teacher, if there is one, have them draw some pictures. That can be important for the child and can make them feel a little better as a way to express themselves. Also, if possible, I don't know if this is always works, but if you know that there's going to be a topic in class or something that comes up that relates to illness or health or sickness, just try to be careful with how you word it with that particular child. Just understand that if you say too many things, it can make them a little more upset.
Yeah.
You may not be able to you may not be able to just remove that whole topic if it's part of your curriculum, but just monitor how the words you use, especially with this kind of child. And I guess lastly would just be in contact with the family. Really know what's going on. Have them, if that father is going for a procedure on a Sunday and Monday the child comes back to school, or was admitted to the hospital, please have them contact you Monday morning and make sure that you tell them, listen, please let me know when things happen so I'm aware. If you're not, it can be difficult. So those are some things I think that may be helpful.
Those are great ideas, and really being sensitive to the whole situation as it relates to the kid, and that's, I think, the kid at any age.
Absolutely.
Yeah, excellent. Could you talk a little bit about what services can be offered to students with general anxiety disorder, especially at the K-5 level?
Sure. So, general anxiety, we're looking at really general anxiety. It kind of covers all different areas. One of the first things I like to do is break down assignments. They're going to most probably feel overwhelmed with work. Even if you think the work isn't much, if they have general anxiety disorder, they're going to start to worry or think about it. So break down some of those assignments. Maybe they don't have to hand it in the next day. Maybe they can split up their writing assignment over a few days, hand in some different drafts. For your kindergartners, if they're required to do certain things in a certain way, maybe you can have them do 2 things at one time and then 2 things at a later time. Because I find that the overwhelming of activities or things to do can exacerbate the anxiety. Look for frustration signs. Again, talk to your parents, but try to catch the frustration early. So if you know that little David or Jane tends to stamp their feet when they start to get frustrated or upset, that's your red flag. That's your key. Okay, next is going to come a little tantrum, and they're going to get upset and worry and cry. If you can pick up on those physical, reactions early, you can kind of jump in and say, it seems like you're frustrated right now. What can we, let's talk for a bit. What can we do? That can bring them down a level before it gets too serious, and then you may lose them. So look for those frustration signs. Slowing them down. They may have a tendency to rush through things because they're nervous that other people are done before them. I see that a lot in the schools. So talk to them about how it's okay. We're not rushing here. Some tests may be timed-oriented. That's true. But for your younger ones, reassure them that they can take their time and that it's okay. And just generally, maybe they're in touch with their school counselor. Have an open communication with them. Talk to them about it. And try to give them extended time when possible. Because when you're anxious, you are going to have a lot of interference with test taking, and it's going to be difficult for you. So
Okay.
be in touch with, be aware of that.
All right, good. I assume this question is more in line with some of the more extreme chronic illnesses, such as diabetes or asthma or heart disease or something like that. But the question is, how can school personnel in a classroom accommodate students with chronic illness who are not medicated for ADA or ADHD rather, or anxiety? So they're not on medication, but they've got something way other thing going on.
Right.
And so could you talk a little bit about that?
Yeah, so depending on the condition, I mean, if we're talking about a serious medical condition, you have to assume the child's not going to be there that often or going to be absent quite a bit. You're going to have to really modify your work, and they may not be able to be responsible for all the work, and there may be even home instruction involved. Be in close contact with those parents. Really know everything you can about what's going on. When there's no medication and there needs to be, you may not be able to say that, but you can say to the counselor or someone, hey, something else needs to be done here, and let's bring the parents in and talk together. Recommend meeting with their pediatrician and say, have you tried talking to your doctor about any other options like medication? Is that something that you're comfortable with? Because a lot of parents steer away from that. If there's issues of ADHD, that's pretty severe and there's no medication, graphic organizers are helpful. Chunking information, breaking it down. Severe chronic illness, the best thing is just to be knowledgeable about it, to work closely with those parents, to be very close with your school nurse, and just to be aware of those physical reactions. And if you know that your child is prone to, your student is prone to dizziness and fainting or vomiting or serious stomach pain, they need to be excused, and you need just to kind of pick up on that early on. But make sure you know that from your parents or from a doctor.
Okay. Along that same line, kind of as a follow-up, a parent is asking about how to tell the child's teacher that the student needs to have assignments broken down. The parent is a little concerned about making the teacher annoyed, or how frequently is that request made, would you say? And is there a way to go about asking that so that you don't set yourself up with the teacher for being a parent that is already complaining and you haven't even started school yet?
Right. So we're going to assume that this child has no formal plan, IEP 504. But
apparently not. I think it's under discussion for the upcoming school year.
Okay. So, we're aware of something. We want some type of help. Look, when the school year starts, there's nothing wrong with going to back to school night, open house, and saying, these are some of my concerns. I would not go in and say things like, listen, my child is struggling with this, and you need to do this. That's not going to be helpful at all. That's not how you communicate.
No, I don't think so.
And so what you want to do is don't be bashful. If you legitimately think your child needs extra time, then you say, listen, I want to talk to you about my child. It seems like you're running a beautiful class. He has some difficulty, and I'm thinking that perhaps he may need some more time. I'm not sure, but it seems like it's headed that way. And I just want you to be aware that, if you come across a test and he's not done, can we consider putting that in? If a teacher is very resistant, then you're going to have to go to kind of the next level, the INRS committee that I mentioned, or the 504, because, if the teacher's not going to be willing, you have to go that route. But usually teachers are open, and you're not going to be that angry, annoying parent. If you say it in a nice way, but in a serious way, I think any teacher will be open to you. They may say things like, let's see how the school year goes first. Let's see how the first month goes before we make decisions. But honestly, extended time is not a big deal. It can be a matter of 10 more minutes, and maybe that child can do that in the library. So.
Yeah, or breaking things down into more segments so that they don't get overwrought with looking at something that's going to take them, 3 weeks of work and then don't know where to begin. So
Right, breaking down assignments
breaking it down
is
is
always important.
a very manageable way to handle it. Had a question regarding your slide about coping strategies,
Sure.
specifically about the modeling techniques. And would you talk a little bit about techniques for teens who are well past the age where exposure to the sights and sounds of medical equipment are going to make any difference? They've done that, they've been there. So talk a little bit about how you handle a teen that's kind of had some medical condition that's long-standing, and
Right.
you've done all those things. Now you need to try something else as a
Right.
parent.
So, with the teen who was going in for a medical procedure, is that more along what we're looking at, like medical procedures, or is it just
Well, just in general, again, it was more about the coping and modeling
right, the modeling?
techniques, and you
Right.
said, like, talk to them about the equipment and how it sounds and all that stuff, and that only works up to a certain age.
Yeah.
It's
Yeah.
not going to
Yeah.
work for a
Right.
teenager.
So for an adolescent, modeling, for an adolescent is giving them education and talking to them about others who've been through this. I recommend reaching out to other people who have the same condition or similar condition and having your adolescent try to talk to that person. They may be reticent, but it can make a world of a difference, modeling that type of behavior. Also, if you as a parent have been through something, you can talk about your experience with that calmly with them and what you've been aware of. I also talk about expectations, like what should we be aware of coming up? Let's run through what's coming up with your condition, the procedures, things of that nature, so they're aware of what to expect and what not to expect. But the modeling is going to have to come from you. I also think about the pediatricians and the groups. Some of my patients have groups, like they'll go to like a diabetic group. We'll have social worker and nutritionists and so forth. Sometimes those groups will sit down and talk to the adolescents and go through different parts of their condition, and they'll model certain things like what to expect and what it looks like, and hook them up with other people in education. So if you can do that, that's great as well. It's really going to come from your personal experiences and experiences of others, and sharing what the worries are and sharing what you've been through and letting them know that.
Okay. This is one of my comments personally, but it's something I feel kind of strongly about. So I'd like you to talk a little bit about the importance of explaining to your child what's going on with them so that they don't make stuff up.
Right.
Kids will make up all kinds of explanations about their condition because they just don't have a good sense about what's going on. And my experience has been that parents, some, not all, parents kind of don't want to get into that with their kid. They just kind of hold back on some of that.
Right.
And the end result is the child, my brain goes like crazy,
Right.
with imagining the worst.
Yeah, no, yeah, and it's kind of a loaded question because there's a few things to look at. You have to consider the age of your child, and you have to consider the type of illness, the severity of it, and how it's kind of manifesting. So, the age. So you have a 4-year-old who has colitis or Crohn's and is having stomach problems or frequent bathroom use and diarrhea and things like that, and that's going to be embarrassing. If they're not necessarily asking a lot of questions, for a child that age, I wouldn't necessarily recommend talking too much about it because it can make them more upset. But if they are asking questions or it's overt, a child is going to, young children are going to make up stuff regardless of what you tell them. So you can't always, you can't always prevent that. But yes, giving them the facts is important. So for a young child, try to get some books out if you can that look towards that type of information, and you can read it with them, and you can show some pictures. Drawing with them and drawing what they go through, bathrooms and so forth, and insulin pumps and things that they need to do. But giving them specific words that they can use in the school. So if a kid says, "What's wrong with you?" and just say, I take these things to make me feel better, and these are my vitamins. and
they
words
knew
like
strategies. Yep.
yeah, and that's all I have to say. They don't have to say anymore, and just so they understand. Uh,
Oh,
yeah.
sorry.
No, no,
Go
no,
ahead.
go ahead.
I've said to parents, it's like telling your kids where babies come from, at
Yeah,
an age. It's age appropriate. So you tell
right,
them what they
right,
need to know so they're satisfied and they get it, and then they can move on and they're okay
exactly,
with it.
exactly.
But, you don't have to go into detail that is beyond what they're capable of understanding. But, they go to bed at night and lay in bed and their brain is going about
Mm-hmm,
what's going on
mm-hmm,
with them.
mm-hmm.
And
And it's increased for those who have anxiety. So,
absolutely.
yeah,
Yeah, absolutely. One more quick question. We're about out of time, but I
sure.
wanted to ask clarification on something. You mentioned the 10-day requirement for home instruction.
Mm-hmm.
Is that 10 consecutive days or 10
Yes.
days? Okay.
No, no, 10 consecutive, yeah. And on the 11th day, it should be provided. Again, I'm speaking from a New Jersey school and how they do it in New Jersey.
Mm-hmm.
I don't know other states, but here, yes, it's 10 consecutive days. And if you know ahead of time that your child will definitely be out 10 days, don't wait till day 9. I would contact your case manager or the school and say, John's going to be out for another 6 days. We need to think about home instruction.
Mm-hmm.
And they'll say,
All right.
definitely, but they won't implement it until the 11th day. They
Okay.
don't have to.
But if your child has some significant chronic illness,
Right.
then wouldn't the home instruction be potentially put into the IEP as something to really be aware that it probably is going to be used just because of this serious
Right.
chronic
Well,
illness?
that's different. That's saying
Okay.
that your child is in special ed and needs a home instruction IEP, which is an IEP
Okay.
that stipulates home instruction, where the home instruction lasts for a maximum of 60 days and then
Okay.
requires review by your county.
Okay, so that 10 days only applies not necessarily in that serious chronic illness situation.
I mean, the 10 days can apply to a regular education student who has a chronic illness, and it also applies to a special ed student. So if your child's an IEP and all of a sudden their illness makes them be out 10 days, that IEP then becomes a home instruction IEP.
Got it.
And
Okay.
it changes, yeah.
All right. Thanks for clarifying that.
Sure,
That was
sure.
a little, I
No, it's a
didn't
good question.
quite understand that. All right. I think at that point we are going to wrap it up tonight. Doctor,
Okay.
thank you very much. Great information, really a very nice presentation. So
Thank you very much.
for joining us.
I appreciate allowing me to speak tonight to everybody.
Good night.
Good night. Take care.
Thank you all for joining our webinar on chronic illness, psychological and educational impact. There is an exit survey which we need everyone attending to fill out. The discussion board is now open and available for the next 7 days on the Wednesday webinar on the NJCTS website for any additional questions that were not covered tonight. That website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to the site. Our next presentation, Educational Rights Part 1, Your Child's Educational Rights and Options, will be discussing about 504s and IEPs, will be presented by Susan Connors and is scheduled for August 15th, 2012. This ends tonight's webinar. Thank you, Dr. Zarabi, for your presentation, and thank you everyone for attending. Good night.
Good night.